My name is Drew Waldron, and I am on with medical analyst and STEM education advocate, Dr. Owais Durrani. Dr. Durrani, thank you so much for taking the time to join me today.
Absolutely. Pleasure to be here. Excited to chat.
What do you share about yourself when you're talking about your background with the audiences that you perform to?
Absolutely, yeah. All my friends will say that, what do you do? That's a common question I get. They're like, you're doing all these random things. But I'm a board certified emergency medicine physician. I'm still practicing, get to, see all types of ailments and help people in that regards. Through that, I would call myself a health tech nerd, right? I've always been a lover of technology ever since I was a kid. And so as I've kind of grown into this role as a physician, I would say I am someone who is passionate about technology and passionate about finding ways to use that technology to help my patients and bridge the gaps that exist within our healthcare system. And then, kind of following along those lines, I think as an emergency medicine physician, I take a lot of complex information and topics and distill that down to my patients in a very short amount of time. And so I translate that into my media work as well, right? You go on a news network and you have like 3 minutes to talk about this complex health topic. And so I try to do that from time to time. And so I would say I'm a medical communicator. I am someone who's passionate about technology when it comes to impacting healthcare and the patients in that space. And then, first and foremost, I am an emergency medicine physician.
And when did you realize that that was a viable career option for you? Because you have to check so many boxes. You have to be very up to date on all this technological development to know how it could be brought into the medical world. You have to have gone through medical school in order to become a medical analyst. On top of all that stuff, when and how did you realize that you were also a great communicator that could pursue this?
Yeah, I think it was the emergency medicine aspect of it. And so, kind of rewinding back a bit, I was in residency during COVID. So, 2018 to 2021 is when I was in residency. And COVID was everything was brand new, right? There was no textbook I had memorized COVID from or a test I had answered COVID on. And so, we were getting so much new information. A lot of it was, is this good information? Is this bad information? Is this study vetted? Is it not? And so I learned that at that time I was, I maybe had a talent or maybe I had practiced it enough where I could take a bunch of information and find out the things that were relevant to clinicians, to patients, and then communicate that. And I did that through like some journal clubs in residency. I did that through talking in my department. And I realized that other folks around me maybe were appreciating that task. And I was like, oh, maybe this is something that is valuable. And so that was actually my first foray into um, uh, uh, let me rephrase that. That was my first foray into media as well. And so I would go on the news and talk about those complex topics in very short bits of time. And I found that people found that useful. And so I've kind of leaned into that and I've developed that skill more and more. And it takes a lot of hard work in that there is a lot of new medical information every single day. And so keeping on top of that is still a challenge, but I think it's exciting. All these amazing things are happening in healthcare today. And a lot of them are going to help burnout. They're going to help patients. And me being playing a small part in kind of communicating that information to both clinicians and patients alike, I think is a very exciting kind of place to be in.
Certainly, and you brought up how much information is coming out week after week and how difficult it is to stay on top of it. Something that I've struggled with is that, especially in the AI world, it feels like we are just getting bombarded from every single angle with new product developments, new technological developments. In the healthcare world, how do you decide what new products and what new news are legitimately helpful and what's just noise? How do you make that distinction?
Yeah, so I think it always comes down to how does this help the clinician or how does this help the patient? Because if you go on any website, you're going to see that AI is going to cure cancer. It's going to eliminate every disease known to mankind. But has it cured cancer yet? No. Has it, drastically changed healthcare? No. But has it impacted my practice in certain ways? It has. And have I seen patients, appreciate that? I have. And so it always comes down to those two questions, right? Does it change my practice or how stressed I'm at work in any type of way? And then how does it impact the patient? And if it doesn't impact those two things, or if it does that in a negative way, then I think it is hype. There is lots of, pros about, how certain things will go, but I always look back to what has it proven. I think a perfect example of that is an AI scribe, right? Many companies have AI scribes, they exist out there. And if you would have asked, before these became a thing, their selling point was like, the clinicians are going to be much more productive. They're going to see many more patients. They're going to spend more time with their patients, and you're going to get a better ROI. Now, I think AI scribes are amazing, but that's not exactly how it's gone, right? So I see about 2 patients an hour in the emergency department. I still see about 2 patients an hour in the emergency department with my AI scribe. So in terms of like pure ROI, is the hospital making a lot more money off of the number of patients I see? No. But am I less burned out? 100%. I go into those patient rooms, I'm able to sit down. I don't feel rushed because I'm not like, hey, I have to get out of here and work on this note. I can answer that extra question. I can spend some extra time explaining a disease process to a patient. I walk out of the room, my note's essentially done. And so it's made my life better. And so it kind of comes back to that question of how is it impacting the clinician? And I feel better. I feel less stressed out. I'm not going home and working on hours of notes. And same thing for my patients. They see me talking to them, explaining things to them, rather than me being in a rush and just trying to get out of that room. And so even though a lot of things, maybe they seem like, hey, this is going to improve ROI in a certain way, that line may not be direct, and it may be, I feel better, I'm going to work, more shifts, or that patient's going to give a better satisfaction score. They're going to come back to that hospital more. And so that ROI will come. It just may not be the direct, hey, we're going to invest X amount of dollars in this tool, and I hope it shows up as 2X next quarter or next year.
I really like that framing. You're not necessarily seeing more patients, but the patients that you are seeing are getting a higher quality care with you being less burnt out. I feel like a lot of patients are skeptical when they hear that AI being injected into every angle of the medical world is going to increase quality, increase patient-physician trust. Similar to that wavelength, what other aspects of AI or any other technologies in the next coming years do you see increasing patient-physician trust in the same aspect?
Yeah, I think it all comes down to, freeing up the physician and making us less, machine-like and robots. And it's kind of ironic to talk about, right? We talk about AI is going to, replace human jobs, or they're going to replace humans in a way. But I actually see it as a almost flip kind of thing. I think what AI is going to do is make the clinician less robotic. Because if you look at how we function, it's all about RVUs and metrics and patients per hour and all types of billing metrics. And that's not why any clinician I know went into healthcare, but unfortunately that's how we get measured and that's how we get evaluated. And so I think AI is going to actually do the opposite. Rather than making us more robotic, it's going to make us more human, and it's going to take care of those robotic tasks. So, another example I'll give you: a patient comes in, they're 80 years old, they've been interacting with this healthcare system for 20, 30 years. There's hundreds of visits and medications and documentation in the EMR. It's impossible for me in the ER to evaluate that in the 5 minutes or 3 minutes I have before I walk into that patient room. But those patient AI summarization tools can kind of give me the pertinent positives and negatives, right? So if they come in with chest pain, it can tell me, hey, they have a cardiac history or they don't, or if they do, what interventions were performed. And so I think it helps the clinician become more human, get all that baseline information, be able to actually then use that to give better patient care. But kind of going back to making us more human, I think is where the big change will be and what I'm excited about.
I like that message, keeping humanity at the center of all this technological change. You've been speaking to audiences for the last few years, and as you speak to more and more audiences, bigger and bigger audiences, what are the main takeaways from your messages that you hope for audiences to absorb while you speak?
Yeah, so I think audiences and everyone in healthcare is excited about the technology that exists and that is coming down the pipeline, and lots of amazing promises are being made. Some of those are already being kind of kept, and we're starting to see the results of that. So I think there is an appetite and excitement for it. And I've seen that unlike, other iterations of technology or things, they were almost kind of shoved down our throat, right? We were in healthcare, you had some law that made some type of technology mandated, and you had to kind of go through with it. No one was excited about this. I'm seeing that people are excited about this technology, whether it's reducing the burden on the clinician, whether it's, catching a pneumothorax or certain type of medical diagnosis earlier on, so you have, better diagnostics, better treatments, and less missed cases or less bad outcomes. Everyone's excited about that. But I think with that excitement comes a bit of caution. The caution is we have this new technology. What are the patient privacy laws that exist? There's lots of, or there's a lack of regulation when it comes to AI. What are we doing that's going to make sure that the patient data and what we're doing is safe? And what will that regulation, when it eventually does come down the line, what will that look like? Will we be, out of bounds and have to change everything? So there's a lot of caution around that as well. And then, of course, there's the cost aspect of things. A lot of these things are very, very expensive. If you're a rural hospital, you may be excited about these technologies. You may be the ones that benefit the most from these technologies and getting access to diagnostics and specialists. But if you can't afford it, how are you going to cope with that? And so that's a message I'm seeing commonly as well. And so I think we are currently in obviously the infant era of how AI is going to impact healthcare. And this is where both clinicians and C-suite leaders and everyone can make the biggest impact. And I think having these conversations out in the open, kind of messaging around them and making sure that, once again, that clinician and patient are at the center of every conversation, that will allow us to kind of set down a road where in 5 or 10 years, we're not regretting the decisions we made, or we're not saying, hey, why didn't we talk about this? And we're not like how we are with EMRs now, where no one loves EMRs, but we have to deal with them.
Dr. Durrani, you have such an interesting worldview and perspective, and it's been fascinating to pick your brain over the course of this interview. And the last thing I want to ask you is, since we were talking about education for a while there, I think one of the best questions we could end on is, can you tell us about an educator who has made a big difference in your life at any stage of your educational career?
Yeah, there's so many. I can, I could list every single teacher from like first grade through 12th grade and college and whatnot. But no, I'll think back to my sixth grade teacher. So I grew up in a very unique kind of household where we would watch the evening news every single day. And so I always had this inclination of like loving current events, having an interest in keeping up with political events in DC and whatnot. I was like the sixth grader who for some reason knew everything about like who these senators were and who the president was. But at the same time, I loved science, and science was my favorite class. And I even back then kind of had this inclination of, hey, I want to go into medicine. I want to kind of pursue this path. And so I remember, we would have this, I forget what the class was called, but basically in sixth grade, this teacher, you would kind of go and explore the things that you were excited about. And so, for example, if you really loved public policy and whatnot, you could, do a project or read up on things in that arena. If you were really big into biology, you could work on some of the projects that were assigned from that class. And I kind of told her at the beginning of this class, where everyone would kind of choose this one project and pursue it throughout the course of the year, I was like, I love both of these. I can't choose between the two. And she kind of made an exception for me. And she's like, well, why don't you do both? I'll let you work half the time on kind of this history related project you're working on. And then this other project was like insect based, entomology and collecting insects and whatnot. And she let me do both. And I guess I didn't realize it at that time, but it really kind of gave me the permission structure of like, hey, just because you're going into this field doesn't mean you can't be passionate about and still interact with this other field, and vice versa. And I think that's what made me into who I am today, where I love healthcare. I obviously participate in it as my career and day job, but I love public policy and advocacy and interacting with the media and finding ways to kind of advocate for my patients through going to the Hill, using media as a mechanism for that. And I would say it all kind of came back to that sixth grade teacher who allowed me to kind of pursue both of those things and made it okay to be like, you don't have to just be the science kid or just be the history kid. You could be both, and that's totally okay.
I met you about 20 minutes ago, and I could clearly see how much that has impacted you to this day. So that's fascinating. Thank you so much for sharing.
Absolutely.
Well, that is going to conclude our conversation with Dr. Durrani. Dr. Durrani, thank you again so much for your time.
Thank you so much. Great talking with you.